Renal denervation is a procedure that we've been doing for about the past 18 months. It's a procedure where we actually disconnect the nerves that run from the brain to the kidney and the kidney to the brain by placing a small catheter, which is a tube that has 4 electrodes on it, and those electrodes are connected to a generator which delivers radiofrequency energy to the wall of the kidney arteries, and that damages the nerves that run between the kidney and the brain in an attempt to help treat people's high blood pressure.
And so the FDA has approved at least 2 renal denervation systems at this time. What method do you use on your patients when it comes to this?
Well, we are using a device that's made by Medtronic. It's a radiofrequency catheter, as I said, which delivers heat to the wall of the artery, and in that way the heat actually gets through the wall of the artery and disrupts the nerves.
How effective is this?
Well, nothing that we do is 100% guarantee that this is going to work in everybody. I mean, we've had studies have shown good results. We've had some good results in our own experience, but this is not necessarily the cure for hypertension. We see it as a very useful tool in people who are otherwise not being completely managed with their normal blood pressure medications.
Is there a specific group of people that you tend to see the most, like age groups or certain ethnicities?
Well, we've seen a broad spectrum of people. We've seen a broad spectrum of age groups, and the study that we're doing now has really tried to include a lot of diversity into the enrollment in the trial, because very oftentimes there are certain portions of the population that are not included in research trials, so it then becomes hard to generalize those results to a broad base of patients. So we're pretty much seeing everybody. We've seen people, I think, as young in their late 20s to others in their late 70s.
And what kind of impact has it had on the hypertensive population of East Texas?
Well, I know this is going to have good impact going forward. I mean, a lot of these patients are in a research trial, so we don't necessarily know exactly what's happening to them at any given time. We're waiting for 6-month follow-up on a lot of them. We've seen some really good successes, and as I said, we've seen other people who have improved marginally and some that have not responded. So I think it's just going to take time to get all that figured out.
And then how far has the procedure come in the last year or so?
Really, the procedure hasn't really changed in the last year. We're doing it the same way we were when we started back in July of 2023. I think, like anything else, the more you do, the better you personally get at it in terms of how you can deliver the treatment to patients. We do anticipate some improvements in the future. We are having to do all these nowadays from an approach in the groin, but this will eventually be something that we can also do from the radial artery in the wrist, where we do a lot of our heart catheterizations now. That should be something that will cut down on complications.
And are you able to give a number of how many patients you've been seeing with this?
Well, we've done somewhere between 45 and 50 procedures right now, which is a pretty good volume. And we see probably, we see a lot of people with hypertension because generally they're folks that haven't been controlled by other physicians or fully by their medications. So we probably see 4 to 5 patients a month that need this.
What does the future of hypertension treatment will look like in your perspective?
Well, I think this is going to definitely have a role in the treatment of hypertension. You know, so many people in America have hypertension. I mean, we would estimate that in East Texas, in Smith County alone, there are probably 100,000 to 120,000 people with hypertension, and a proportion of those, maybe 15 or 20% of those, are not controlled on their medications. So that's a big problem here. I mean, obviously this is a problem across the nation. It fits in with what we see with growing obesity problem, et cetera. So I think this is going to be a tool going forward. This is not going to cure people's high blood pressure, but hopefully it'll make it easier to treat, which will lead to less complications short and long term.